Hello! Welcome to the Close Community Meeting, the first quarterly meeting of the school year that we are going to be hosting in the town of Longmeadow. This is the Coalition of Longmeadow Organizing Substance Education for the Community. My name is Paul McNeil. I'm the coalition coordinator, and I'm surrounded by very active coalition community members, which we're really excited about tonight. It's been awful rain all night, so we're very excited that folks turned out. And I'm joined by Shelley Warren, our current board president. This is her last meeting of her tenure with the coalition after 8 years. Is that what it means? She said
From when it started, yeah.
Holy
before we
smokes.
were funded, so.
8 years. So
Yeah.
this is a big night, a momentous night. But thanks for coming back and joining us with LCTV. We love your support in producing this and sharing this with the community. Thank you, Brian and Doug. And we're going to jump right into today's agenda. And the agenda will include quite a few things, so it'll be a bit of a dynamic meeting tonight as far as we'll talk about some updates from our environmental strategies. One of the things that's not an environmental strategy, but we're still going to do right away, right at the top, is voting on a board of directors slate for this upcoming year. We're talking about Cannabis Billboard Tracking Project, which we had an event in the spring, a vaping shoulder tap survey. We had a bunch of qualitative data collection meetings and events over the summer, which was really fun to collect qualitative data to go with all of our hard quantitative data numbers that we get from the school health survey. And then we are going to have some updates around our close community action teams, outreach and marketing. We're going to celebrate Shelley Warren for a moment, which is exciting. We already did pre-taping, but get ready for a little more. Youth cannabis use prevention updates, assessment and evaluation, and then overdose prevention and recovery updates. So that's our agenda for tonight. The first thing we're going to do is look at our close board slate, which includes Grace Caricetti or Cherichetti?
Caricetti.
Caricetti, LHS class of 24. Andrew Healy, medical director of obstetrics at Bay State Medical Center and spouse of current board member Candace Healy, project director at Holyoke Public Schools, both parents in Longmeadow Public Schools. Charlotte LaForest, reverend at St. Andrew's Church here in Longmeadow. Chris Rich, hey, Lisa Taylor Kelly is here.
She has to be on this too, right?
Oh my gosh, yeah. On the list.
Yeah.
I'll add that to the list as well. Chris Rich, life coach in town. Vivian Welch, LHS class of 25. And I'm going to add Lisa Taylor Kelly, which I'm really glad she showed up because you might not have made the list.
I think I might go. I'm hurt. You don't know what
It's
I
a
went
sign.
through to get here.
Yeah.
I know.
We do.
You kept
Holy
waiting
moly.
for a lull.
Did you
and
go
it just
down
doesn't
Converse?
happen.
Yes.
Is it
No,
flooded?
It is
Yes.
flooded.
Oh.
Well, I'm really glad you showed up, Lisa.
People like
because-
off the mood.
all right. Well,
Got my booties.
Shelley, do you want to explain just how the board vote works for the community, and then we'll follow through with the vote?
Sure. So the current board of directors has recruited and nominated people for the subsequent board, and the board is a one-year term, but you may repeat years. So we have some people returning and some people who are stepping off, including myself and Amy. So I want to recognize the service on the board and. So anyway, when the current board nominates a slate, it is voted at one of the quarterly coalition meetings for approval. So we do have enough people here to vote in the next board. So I will call for a vote, and then immediately after this coalition meeting, we will have a board meeting separately for new board members, and I can kind of explain through the bylaws how that transition process works.
Cool.
So without further ado, we usually vote as a slate and not individuals because we have never had, our bylaws allow us to have up to 9, and we've never had more than 9, so we've never had to have a competitive vote, for the board, obviously. So we can vote to accept the slate as is. If there is anybody who would like to discuss before I call for a vote, would anybody like to say anything?
Come on.
Yeah, this is Amy Higgins' last
I know,
meeting.
I know.
She's outgoing board member, so that's also exciting. Okay.
All right, without further ado, all in favor of accepting the board as nominated?
I see 1, 2, 3, 4, 5, 6. I see 6 hands in attendance, 6 yays,
And all opposed? Nobody?
0
Sorry,
nays.
I was just
Whoa, I almost saw 2 nays with 1 person. You almost nayed yourself. That's great. So that looks like it's going to be our board for this upcoming year. Yeah, what's the next step with
So I know, well, I'll address the
Yeah.
people afterwards
Cool.
as far as next steps go.
All right.
So-
We're going to have a board meeting immediately following this coalition meeting, so that will not be on film. All right, let's keep it going. June 1st, we had a cannabis billboard data collection project event. We had 6 Long Meadow High School students. We added 12 billboards from the Springfield area. There's no billboards in Long Meadow that advertise alcohol or cannabis products. So we added 12 billboards from the Springfield area to the database. It was really slow moving for an event to use young people to collect that data. It would be much more fun and engaging, I think, to have parents and teens alike driving around and finding these billboards on a map and just taking a picture and using real-time data around what is being advertised on those billboards. I think that would just be more fun and engaging. They were just all sitting around computers. We had a pizza party, which is fun. We were just sort of sitting around our computers for an hour and a half, just pressing buttons and looking at different Google Maps. So it wasn't as fun, I think, as driving out in the community. So we'll try that again, I think, later in the fall. And it could be a fun thing for parents to do too who want to volunteer. So let me know. info@closecommunity.org if you want to volunteer. We also did an electronic nicotine delivery system shoulder tap survey where we use a young-looking students, but they're not. They look like maybe 18, 19 years old. We have them stand out in front of a vape shop and they ask complete strangers, "Hey, if I gave you $10, would you buy me this particular vaping product?" And we did this on Thursday, August 3rd, over the summer. We had 3 Enfield Police Explorers, which are really amazing young people that are interested in the criminal justice system down the road. Those are high schoolers. And then 1 high school leader from Enfield Together Coalition, which is our sister coalition down in Enfield with drug-free communities funding from the CDC. And we went to Voltage Vape Store. They were really supportive in hosting us, and No Limit Smoke Snack, which they were also amazing hosts. We approached 59 customers in total. 8 of those 59, this is backwards. 8 of those 59 agreed to purchase vaping products for an unknown minor. So most of 86% refused. I mixed up that data point. 86% of customers approached refused to buy a minor when they were approached vaping products, which is an increase of 9% from last summer. So this is getting out, and we put this ad in the newspapers locally in Enfield and Longmeadow that most Enfield residents do the right thing. When we thank Voltage Vape and we thank No Limit. So this little ad that you see on this slide will go into the local newspapers in the fall, thanking those 2 shops. But also, ironically, only 1 or 2, I think, of the license plates we saw at these stores that night were Connecticut. Almost all were Massachusetts. So I think the reason was flavored vaping products. So that's what everyone was surmising. We don't know for a fact, but we'd love to have interviewed all the people. Why are you here and not Massachusetts? But yeah, we think it was because there's no flavored vaping products legally sold in Massachusetts anymore. So maybe that's the reason.
Aren't they also illegal in Connecticut now, too? I thought it was a federal ban.
I mean, they had tons of flavors at the place that we went. So I don't think it's illegal. Maybe I'm wrong. Maybe there's a different reason. But they were all Massachusetts plates, so I don't know what was going on with that. But thank you to those 2 stores, Voltage Vape and No Limit. All right, well, we did some qualitative assessment we have some key findings from our qualitative assessment data collection over the summer. I had a standard interview that I used for six folks in town, different stakeholders. I had a youth focus group with recent Long Meadow High School graduates. I compared findings from previous focus groups. We had a parent focus group that we were planning to host later in the fall, so we don't have any data from that yet. And we'll standardize that data as well compared to previous parent focus groups. And then we'd love to have just sort of a more comprehensive report on all this qualitative data at the end of the fall, ready to go, before the holidays, which is exciting. I love combining this qualitative data with the quantitative data that we have. The youth focus group, these were key takeaways that we had. That there was incredible health and wellness classes at the middle and high school. Really, really positive responses from the teachers and just how supportive they were. There was no shame, there was no judgment, no stigma around talking about sex and substance use and substances and the impact of substances. So they felt really supported and they felt really informed. They did feel like at the end of their senior year, at the end of 12th grade, Cape Week was just kind of a scary concern around substance use. They love the idea of socializing with their peer group, but not necessarily, binge drinking or using substances and driving all around the Cape. They thought that was kind of a, risky, scary concern. And then vaping in bathrooms is just something that needs to be addressed even more aggressively than is currently being done. And the idea for vape detectors has come up, regularly with youth stakeholder interviews and focus groups. So we don't have them. We don't have them currently. We have an application in for some funding for those now. Driving cannabis impaired is a major issue. As soon as cannabis was legalized, it became more of an issue where people are smelling it all over the public streets of Longmeadow, and people are nervous that there's cannabis impaired driving just happening much more regularly. Longmeadow is a close-knit, supportive, caring community. So that's something that was just sort of uniform throughout all the interviews. Key stakeholder interviews, and this is across at least 4 sectors. Close-knit community, parents really care, parent norms around their own drinking potentially needs to change. So just parents sort of saying, do as I say, not as I do, as far as healthy relationship with alcohol. Cape Week is a real challenge for parents, it sounds like, to navigate. And when parents host, this is one parent, local parent, who I think has a great twist on our campaign, which instead of when parents host, they lose the most. We want to change it, I think, in the future from when parents host, everyone loses as far as social host liability because of the impact we've seen in this community. Vaping in the bathrooms is still is a major concern for middle and high school students, and this is parents said this as well as students. The more social media, the better, as far as like sharing information and education and opportunities for events and engagement. Social media literacy for parents just knowing how to navigate, social media. And we'll talk about an event we could do for this coming up, which is really responsive, I think, to that addressed need. Parents needing to know how to manage their children's social media use because they're exposed to so many things, including access to substances potentially. I'm not going to get into the nitty-gritty of all of these, but this will be in the report, and this will also be on LCTV's coverage of this and on YouTube. But if you want to take a closer look at youth development professionals, law enforcement, healthcare professionals, and school officials, all just different anecdotes from those key stakeholder interviews. Also, shared perceptions and beliefs. I could spend a lot more time about this. I can just go down the list. I just think it's interesting to address it. Just students using around 12 to 14 years old, 12 to 14 years old for the first time. That sort of seems commonplace in people's perceptions. It's not as dangerous as alcohol. This is addressing cannabis. People thinking it's not as risky. Law enforcement is inconsistent, and not necessarily being law enforcement's because of law enforcement, but because the laws are really challenging, I think, to enforce around cannabis and youth possession of alcohol. Confident there will be diversion, which is good. That's a good thing. Focus messaging on developing brain. People really like developing brain messaging as opposed to like, don't do drugs. Drugs are bad, or they make you a bad person. That messaging is outdated and doesn't work. But developing brain messaging, people find to work. It's becoming more normal to use. This was in particular, I think, cannabis. Impaired driving and edibles are urgent concerns, especially with edibles and just the potential for being cannabis impaired and being in school without really much detection. People are using to relax, self-medicate. That's cannabis and alcohol. Education needs to start early, which we're trying to do a good job of that. All 5th graders are going to get Buttman Life Skills this year again, which is an evidence-based prevention curriculum. Parents need to talk with their children early and often. Parents providing it is not normal, which is great. Parents providing alcohol and other substances is not normal. Adult behavior does matter. I think it's easy for parents to lose track of that when parents are told by their teenagers, that their opinion doesn't matter, or that they're not as cool as the parent thinks that they are. But their behavior matters. Youth want to and need to be involved in education and messaging efforts. That's been instrumental with Longmeadow Youth, with our social norms messaging. campaigns, which Vivian was so helpful with and instrumental in developing last year. Can you help us again this year? She said yes, folks. She said yes. Vaping makes
No pressure on the spot.
makes
you know.
vaping is much easier to conceal cannabis or a nicotine-based product, and so that's one of the things we want to talk about with the vaping detectors and introducing those into the school. Unknown how police will test for OUI still with cannabis-related products, outside of the traditional sobriety test, field sobriety test. There's no, they're not doing warrants for urine or warrants for saliva or anything like that right now. Shelley, would you want to just talk a little bit about vaping detectors and how that might be really helpful in not necessarily the punitive response to vaping, but in sort of more of a restorative, supportive response?
Sure. Well, we have a proposal out right now to use hopefully some of the opiate settlement funding to install a set of vape detectors at the middle and high school level. Not everywhere, like not all the bathrooms, but enough to like kind of see if this approach would work. So we're awaiting a decision hopefully soon from the health department on that. But the thinking is that we know that it's happening. We have a lot of anecdotal evidence that we hear, and we are only intervening in like a small number of those cases. So it takes away from the safety and atmosphere of the bathrooms for the students who aren't vaping, which is the majority of our students that are not vaping, while like not having any effective intervention in place for the students who are vaping and not getting caught. So for students who do get caught, we have a diversion approach already. They're referred to see me, and I use the American Lung Association's in-depth program with them to try to like educate them about vaping and the risks of vaping, and also like other ways that they can address the needs they might be having that they're addressing through vaping. So,
That's
so
an
we already have
evidence-based
that.
intervention. It's like
Yeah.
the gold standard way to respond.
So in that, we also, don't externally suspend for vaping for nicotine. We use internal suspension and again, supportive counseling and the in-depth program. So we already have that in place. And the thinking behind the vape detectors wouldn't be to get more kids in trouble. We're not looking to interfere with an educational process, but more to divert students towards interventions and supports that we do have in place here to address it, because we know that from our data, we know that the students who are vaping tend to also have higher risk in other areas of their life. So they are more likely to suffer from depression, more likely to be anxious, more likely to be struggling at school. There's other risk factors that are higher, and also more likely to be using cannabis. There's a real high correlation, between those two groups. So we view it as Paul says, an upstream intervention. If we could get vape detectors, we would be able to intervene with more students earlier, and hopefully head it off. And then it would be, I'm looking to you students to see what you think. If it would be a deterrent, the thinking is,
Yeah.
for people to use so freely in the bathrooms. So it could also prevent some students who might not purchase their own vape, but might first be exposed to it in a school bathroom, right? So if it was higher stakes in the school bathroom, it would make it easier for some students to just kind of say no and not get involved.
Yeah.
So
And that's one of the major strategies that our coalition is funded to address, which is physical design. So changing
Yeah.
somehow the physical design of where young people are growing up, so that substance use is less likely, healthy choices are more likely. And so if a student walks into a bathroom and sees a vaping detector, they're less likely to take that risky behavior of using a vape. And vaping is really addictive too.
Amy had her hand
Yeah,
up.
Amy Higgins, board member.
I feel like I should know this, but does the vaping detector detect smoke like a smoke detector in one's home?
I'm not sure what you mean
How
by
does
that.
it? How
Yeah, there's a
does the
sensor.
vaping detector?
There's a sensor.
Does it work?
So when there's a
Yep.
how does it work? Is there
Yeah.
a
There's a
smell
sensor.
and it goes beep?
And actually, the ones that we're looking at can tell the difference between if somebody sprays an aerosol
Aerosol.
room freshener versus nicotine versus THC.
Okay.
They're actually really much more sensitive than they used to be.
Okay.
So and it's pretty amazing, actually. They also detect conflict. They can detect if there's a
Like
conflict
elevated
that starts to
volumes and
happen
stuff.
in a bathroom, and you can
Interesting.
program them to also have code words for help, so that if something does go down in the bathroom, a student can activate it with their voice, and an administrator would show up in that bathroom immediately. So there are also safety features
Okay.
to them now, and schools are using them not just for detection of vaping, nicotine or cannabis, but also for
And
safety.
how does
So-
this, is this an alarm goes off, or is this an app?
Yeah,
that
it's an
someone
app.
has?
So it is linked with your administrator's school-issued cell phones and email systems. So like if a vape detector goes off, the administrators get a notification in real time that that vape detector has gone off. You can program it so that they will also make noise when they go off. I don't think we would want to go that route. The schools that I've talked to who have used it, to be honest, they have them go off more often than they can respond to, so like depends on what else is going on in the administrator's plate, if they can like drop everything and go to the bathroom right away. But I think we would want, the big thing is when you first roll it out, to try to be as responsive as you can at first, so that you're kind of training students that the bathrooms are more monitored, than they used to be. So you want to have like a big response when you initially roll it out especially, but you may not, obviously you can't respond to every instance that gets detected, so.
That's helpful.
It can also
Thank
be
you.
synced with your cameras. This is
Oh.
like really, it can be synced, you have no cameras in the
But in the
bathrooms, that's
bathroom,
illegal.
yeah, right.
But there are cameras outside of the bathrooms, so you can actually, it'll take a picture after it goes off. You'll see who left the bathroom after the detectors went off. So, it's like pretty, yeah,
That
they're
was-
pretty sophisticated.
Pretty cutting edge.
My seventh grader had walked into a vaping situation in the bathroom last week. So my question was,
Last
what are you
week?
doing for
Yeah.
for the middle school? Do they come
The
to you
proposal
as
is
well?
for both the middle school, oh, yes.
No,
yeah,
I'm talking about like what intervention did the middle schoolers?
Yes, I provide for both.
Okay.
So I go there, they don't come here, but I'll go to the
And
middle school.
we presented, Shelley and I presented to all middle school staff was it last spring? On just,
I think it was fall or winter.
was it the fall? Oh my gosh,
Yeah.
time is
Yeah.
flying. Well, presented on the current, sort of like the state of vaping, and just gave them the current use rates, the risk factors, the impact of vaping at a young age, what to look for. It was like this nice kind of comprehensive presentation because I think they were really concerned, like, what do we do about this, as teachers?
Yeah.
Because we can't intervene every time, all the time. And so it was really helpful. I think we had a good dialogue about, like, how do we respond as a community, how do we respond as teachers. I think the vaping detectors would be this really great cog in the wheel of how we're responding. It's just, yeah,
Like the drawback is you don't want, like this, it's, some schools use metal detectors as a safety thing, but you don't want to create an atmosphere, right, where it feels like a police state,
Yeah.
or like Big Brother's watching you or anything like that. So we definitely would want them framed not that way. It's really to support the majority of students who don't want to deal with vaping in the bathrooms, and to create like space, hold that space in the school, not to be like, oh, we want to catch, everybody who's vaping. Like, you don't want it to feel like, we're trying to watch what students are doing everywhere, because we're not. So I'd be curious to hear your thoughts about it as students, if you have any.
I mean, sounds good.
Yeah, I mean, it does sound like a good idea. I don't know how, like, the student body would, like, take it, though. I feel like it might have some negative reactions.
Like, some people would feel,
Yeah, even if they, like, aren't vaping in
Intruded
the
upon.
bathroom.
Yeah.
It might just feel like, they might just have, like, a negative reaction anyway. Just because it feels like, I don't know, maybe.
it is
invasive, maybe?
Yeah.
There's no recording. It doesn't record anything in the bathroom. So even though it can detect conflict, it doesn't record conversations or anything like
Yeah.
that. So we would definitely want students to know that, that it can't capture any data that way, but it can just detect things and alert us to something that's happening. So.
So if we got these, the information would be given to the students about like.
Oh, yeah.
all
Oh,
this.
yeah. We're not trying to, like, surprise students with them. Because I would love for a student to be like, oh, I'm not going to vape in the bathroom. That's way better than, getting caught vaping in the
Yeah,
bathroom.
because
So-
I'm afraid of getting caught, I'm not.
Yeah,
going to.
exactly. Leave your vape at home. Like, right? If you have that option and you have that level of control over your habit still at that point, you're going to choose to leave your vape at home. So, and I've had some students actually say to me who knew I was writing the proposal, who were struggling with vaping, and saying like, that would be helpful.
I
if
need all
knew-
the help I can get
Yeah.
to not vape.
Yeah, it would be helpful if I knew I couldn't vape at school so easily, because school was like the place where they were more likely to be exposed to, if they were trying to quit on their own, like that was an exposure point for some of the students, and they'd have to strategize about what bathrooms to use when and how to avoid, being offered, so.
The other night, we heard a story, and it was not the first time I'd heard it, but I've only heard maybe 2 or 3 people talk about not going to the bathroom during the school day because they didn't want to be in the bathrooms with all the vaping. And I had forgotten that there were stories like that, and that made me sad. So if it would allow students like that actually to have some peace and freedom to just go do what they're supposed to be doing in the bathroom, I think it would be a great relief.
Yeah, yeah. And I think there would be some relief on staff too, who are reluctant to walk into the bathrooms. You know, like that's an uncomfortable situation. Like it should be a private student space, you know, like we don't want to be walking into student bathroom spaces. So it also relieves, I think, that too, if it's a device that detects it and it's not on staff to always be walking in to detect it. So, anyway.
Well, thank you.
Yeah.
This was kind of the next slide after this, which was think, pair, share. But this is a good group to know. We don't probably need that because everyone in this room has talked openly about these things in the past. So we can just talk openly about it. But I'll share 3 themes that came up with the qualitative data collection, and then we can talk a little bit more if people want. But I'm going to change law enforcement. I wouldn't say just law enforcement was a theme that came up that is a deterrent and a supporter in prevention of substance use for young people, but rule enforcement or just norms enforcement, I think, for parents, for schools, and not just like the actual police or law enforcement. Just holding their end of the bargain. And normalization, that's an issue. You know, binge drinking, especially like something like Cape Week, has been so normal for so long. How do you address that? I think we've done a really good job. I got good feedback from a few key sector representatives around just grad party season has just shifted. And there's been a lot of things that have helped, I think, the community do that. And that grad party season has just become safer in the last 10 years, which is, I think the coalition's been a part of that. And the messaging is just really important. You know, not being judgmental, not being punitive with students, trying to heal kids and help them and support them instead of trying to hurt them, you know, with a criminal record or hurt them with kicking them off a sports team or whatever. It's a very caring community that wants to support young people. Making the healthy choice the easy choice. I think nicotine is so addictive. People don't know. You know, it's more addictive than cocaine. So it's very hard to quit. And so the more support young people can get in this key developmental neurological phase of their life, the more help they can get to quit, the better. And then, yeah, I was going to think, pair, share. Just want to take
It's
a
that
moment.
share.
That's a current day share. She looks amazing. But we don't need to think, pair, share. But if there are any more like just questions or any feedback about the sort of the data that we have been collecting over the summer, it'd be a great time to talk about it. We have some time to talk now.
Did you speak with law enforcement
Yeah.
representatives while you were doing that?
Yeah, law enforcement leaders. One of them was from another town, just around opioid, supporting people in recovery, and the drug addiction response team. I was recommended to go talk to a law enforcement leader from an adjacent town, and they had an awesome perspective on all of it, and just really good feedback for how to use opioid abatement funds in particular. That would be more regional and not just like town by town. It was just really helpful. But they were giving similar upstream, just like how important it is not to have community-based events that have drinking be a part of them, and how Longmeadow forever seemed to be like really safe and protected in that way, but then it started to shift, where you have, you know, Longmeadow Days or Fall Fest or whatever. There's alcohol available now, and that was just never part of the event before. So things like that shifting and changing might not be for the best of some parts of the community. Other questions or? Oh, did you have questions about law enforcement in particular?
I was just curious if you had their perspective on it, because I do think it is hard. They're in a hard spot for enforcement.
Yeah.
So.
I think law enforcement, of all the people I interviewed, the key stakeholder interviews, two law enforcement officials I interviewed, one in particular, spent the most time saying how many wonderful protective things there are in this town, which I thought was interesting. Because I think, I know there's law enforcement officials in my family, and it's really easy to be jaded. I mean, you're seeing like the worst of things so frequently, and so it's so easy to be jaded. But not jaded at all, these people I was talking to, about how wonderful a place it is to raise kids. So I thought that was so cool. And that they feel their role in that is very important, which I think is awesome.
Is this a place I can bring up screenagers, or are we not there yet?
Oh,
Or no, that's next.
where did that? Yeah, this is it.
This
This
is
is
it.
Shelley's chance to talk about
Okay.
screenagers.
All right. Were any of you here involved in the screenagers screening that we did? Like it was screenagers focused on like the role of screen time in developing teenagers' brains. This was before the pandemic, so it had to be like 5 years ago.
4 or 5 years, yeah.
So she has since, actually there's been a sequel, which we did not connect with at all, which updated, and then there's a third one out now, Screenagers Under the Influence. And I had the opportunity to preview it and really liked it, and so I wanted to bring it up as an idea for us to host a community screening. And Paul said that CADCA did a national screening for coalitions as well, which
Yeah, it
was
was
also really well
last week.
received. So, so anyway, I wanted to see what you would think of that. And it would be a community screening geared towards parents, but they actually suggest that you can have anybody, I think it's over the age of 7 or 9, attend with their parents, because they really think you should be having the conversations together as a family. But it touched on so many of the topics that we have touched on in our coalition. So it's not just a look at one substance, which is what I really liked. Like we've brought in programs. Last year we had a program focused on cannabis, but that was the one substance it was focused on. So this would be more like breadth and not like in depth on any one substance. But she addresses like parental normalization of drinking, is one of the topics that she talks about in there. She addresses current cannabis patterns and how the current cannabis is different from the way it was in the past. She talks about the fentanyl crisis and the overdose risk to kids now with counterfeit pills. She has just like everything, even like the shifting, thinking about psychedelics, and like every topic that we have talked about was pretty much in there. So I was interested in seeing what you thought, if you thought parents would respond and come out to a screening.
So would it be a screening followed by an opportunity to ask questions and talk about what we just saw or what parents just saw?
I think that would be, they provide a discussion guide,
Okay.
with the screening, so I think that would be the idea, is
Yeah.
that you could do a Q&A. We could have some panelists, connected to the topics that would be up there.
We could include, there were 2 Long Meadow students. You were at the social media, the DA's event last?
Yeah, yep.
Did they graduate?
No, we actually have 2 students here who are on the DA Youth Advisory
Yeah.
Board who are on the Substance Use Committee for that board, so
And they've
we
already
could see if they
presented on
would
this in
tap.
the past, like on a panel. They'd be awesome.
Yeah, yeah. Yeah, because she's not only talking about like the use of Snapchat for dealing, like that's not, the focus is not only on like what students do through screens, it's on like the risks of substance use overall. Like so it was a broader, I was happy to see it was like a broader thing. But I thought it could be a good panel opportunity afterwards. I think it would be interesting to also put out see if any community providers would come out and have like a little table, tables outside so
Yeah.
people could see what's
Community
available.
resource
Yeah, community
fair.
resource fair with it.
I think it sounds
So-
like a great idea.
Yeah.
And we haven't done something like that in a while, because like the special programs has not been up and running, for the past few years. Like we've still hosted events as a coalition, but the district has kind of stepped back from bringing in speakers on its own. So this is something we could still do on our program.
My mom says she misses those speakers, so.
Yeah.
Really?
Yeah.
Oh, that
Yeah.
warms my heart.
Grace, you're going to be a great board member.
Yeah, it's been a while since we've had, other than
Is that
who
just
we
a
hosted
COVID
last
thing?
year, right? COVID is what kind of stopped it, and we did do virtual programs in that first year through like Minding Your Mind and, things like that, but they really weren't as well engaged with, as when we had some momentum going, I think, before with special programs, and COVID just kind of like put it all on hiatus. But I don't know if there are plans or not to like bring it back exactly the way it was, So, so in the absence of that, or while that's still in the works, whatever, I think we could still pursue our own
Yeah.
screening. And Paul was saying that we have money in our budget set aside for sponsoring speakers for the community or for parents, and it's not that expensive. I think it's $700 for a community screening, which allows you to show it once. You can't. We can't show it multiple times. We can't share it like in the links to the high school and the middle schools or whatever. So it would be like one time LHS auditorium showing. And see who we
BYOP?
get. BYO.
Popcorn.
Popcorn?
Oh,
Bring
popcorn.
popcorn.
We can't have popcorn in the theater.
Oh.
Really?
Yeah, no food or drink.
That's a great idea.
Very strict in there about
I think
that.
so there would be SBYOP, so
Yeah.
secretly
You can bring your
up.
children, bring your own
Yeah,
children.
I mean, if you wanted popcorn, the BTC you can have popcorn in.
Oh.
If we thought we wanted a more, I mean,
Intimate.
yeah, more. It depends on what we
We
want.
want to blow it
right?
open, though. We want it big.
So-
It would have to be SBYOP CQ. Secretly bring your own popcorn, chew quietly. CYO, CYM.
Eat
Clean
your
mess.
popcorn before you come
Yeah.
and
Yeah.
enjoy the screening.
Yes, thank you. Fill up with the popcorn.
Yeah, yeah.
Yeah, I think it's a great idea.
No idea, yeah.
It seems timely, right? We had a lot of parent interest in this idea last year, but we didn't have this film, so it was like, it's kind of
Yeah.
perfect timing.
All right.
Yeah, all right,
So
let's
we
move
can
on.
move forward.
Since
and
we have-
I guess we probably want to check, the next steps would probably be checking with Marty on clearing a calendar, approving a
Exactly.
calendar date
Getting
for
a
it.
good date.
And,
And then getting a food truck and getting Batch to come out. I just wish we knew someone that worked there. Do you work there?
No.
Oh, but you guys know
Guys.
people who work there.
Yeah, literally
Great.
everyone works there.
Literally, yeah. Like, there's
Except
3
us.
students who don't work there.
Yeah.
last time I went in there, like every single person working there, like
Was a
knew
peer
me.
leader?
Like, or I knew them somehow, right? Like
Yeah.
every student, it was the poor woman behind me was like, you're like famous here. And, like,
The answer is yes, yeah.
Like, oh, Mrs. Warren. Oh, hi,
Fame is
Mrs.
relative.
Warren. I'm like, it's not because I come all the time.
Well, I wanted to give an
So-
update about the youth mental health first aid training, which we wanted to. Our real goal as a coalition was to bring this training to the youth leaders of the high school who want to be supportive of their peers. But in order to do that, we have to get a certain amount of professional staff and faculty trained from Long Meadow Public Schools in youth mental health first aid. And we had a great kickoff event to do that at the beginning of the school year in late August. We brought out 4 trainers for youth mental health first aid. We teamed up with St. Andrew's Church and Reverend Charlotte LaForest hosted us and provided wonderful food for lunch for 55 LPS paraprofessionals who got trained in youth mental health first aid. It was a full day training. There was actually a pre-training the day before that. So it was a big deal. And now we've got all this momentum for eventually being able to train our youth in the next year or two in youth mental health first aid and the skills that would give them to support their peers when they're in sort of social, emotional, or mental health need. So that was an exciting, big step for us. It took like a year to get this done. But we'll get even more teachers trained in the coming year and start to look at how to get youth trained. We have to get on the schedule for youth mental health first aid trainers, like at least a year out at this point for youth. So
Yeah, it's a long process, but
It's a long-
but it came up originally at I think our fall meeting
It might
last
have been-
year.
it might have been Grace who
I
came
think
up with
Grace
it.
might have brought it up. Yeah,
you were just
when-
like 10 years old or something. You brought it up years ago. And now you're going to be a senior?
Yeah,
Maybe you'll see it actually happen a little?
maybe.
Maybe. Because you're a junior this year.
No, I'm.
No.
Oh, you're senior this year.
No,
You'll see it
she
happen.
might not. She might not.
But these are the
But you-
seeds, Grace. You're planting the seeds. And Vivian will water the seeds.
It's just surprisingly like many hoops to go through.
I wanted to share some data too that's quantitative in nature. And I like thinking about this quote, data isn't truth, it's signal, data just is. Because people get real hung up on like, well, how do you know it's really true? And it's like, well, we don't, and it isn't. But it tells you something, gives you a picture. We finally started collecting and analyzing middle school data. We've been collecting it for years, but we started to analyze it this year and share it with the middle schools. Around 8th grade, 30-day substance use. We don't quite have trend data. We don't have enough years for that, but we're on our way. But you could see that there's been a drop-off in vaping nicotine. There's a bump up in, post-COVID. Oh, is that the lightning and thunder
Yeah.
warning? Tornado? You know what I love? We don't know. We don't know what it is, but we know it's an alarm. Does anyone
People
know?
have alerts on their phones if it's
Oh, it
something
could
we
be
should.
Yeah, that's true.
flooding, maybe.
Huh?
It could be
Oh, it could be
flooding.
flooding. Thanks, Vivian. Alcohol, a lot of things bumped up in 2022, and then they're starting to calm back down in 2023. Binge drinking was virtually nil last year for eighth graders, which is great. I mean, they're really low numbers still, but we just wanted to show that there is a trend, trending down toward healthier behaviors across the board. Electronic nicotine delivery systems was trending down for years, and then COVID happened, and there was a big rebound up after that. And then we look like we're on our way down again, but 3 times higher is a 30-day 7th grade use. And again, it's at 2.3%, so let's take that with a grain of salt. But it's higher than it was in 2022 at 0.5%, 3 times higher. So this is the vaping trends for the middle school. Some mental health indicators for middle schoolers. And the reason I'm sharing middle school is because we shared the high school data in the spring. We see depression, anxiety, self-harm sort of all on the up and up after 2020. I think COVID exacerbated a lot of these things, which were already trending up. And so, not surprising, higher for 8th graders across the board. Yeah, 1 out of 3 8th graders reporting anxiety. 1 out of 3 7th graders reporting anxiety. So, that's in the past 12 months. So, pretty high rates here in Longmeadow. I don't think it's surprising, but I think it's just helpful to see the numbers.
Paul, I would
Yeah.
just want to add that this data pretty much mirrors what we see in adult medical claims data.
Oh, interesting.
Almost exactly the same anxiety, depression, yet at that rate, so.
Just the
Interesting.
trend.
Kids
is
and
on.
adults, yep.
Yeah.
So not surprising to you.
No. Well, I mean, so, yeah, well, yes, actually surprising, but interesting. Anxiety is the number one.
Oh, because your work, you work
Mm-hmm.
you work in. I always want to say like HR communications, but
Yep.
that's not.
Well, HR well-being, benefits,
HR well-being.
benefits, yep.
For a big local company that does health insurance. So you see that stuff. E-cigarette trends around perceptions and around how many peers use, how many peers think it's okay, how many peers think it's risky. And what you see is the perceptions that most people are using, they're going down for 8th graders, which is great because it's becoming less normal to think that everybody's vaping. Perceptions that peers think that your use is that your use is okay. Sorry, that your use is. I think I got cut off. I believe it's actually not okay. Perception that your use of vaping is wrong is on the up, which is good. It's still up around 92% from 69% in 2018. Perception that use is risky is kind of staying up in the high 80s area, 80%. And then non-30-day use rate, vast majority of 8th graders not using vaping products, 97% last year. And this was social norms campaign. Vivian was instrumental in developing the high school campaign. We worked with the peer leader groups from both Glenbrook and Williams Middle School to develop these messages. But it mimicked something Vivian had initiated with her peers, which was really healthy, beautiful outdoor scenes, social media, like taking social media platform imagery and like overlaying healthy data, which we thought was fun. And then just people being friendly and supportive and doing healthy things like hiking. And animals. People loved animals.
That was the high school theme
Ducks,
last year,
cats,
right? Yeah.
dogs, yeah. Cute, cuddly animals. Safe Homes Directory, sign up. We have some parents signing up for the Safe Homes Directory. There's a little QR code right there. If you want to commit to being in the Safe Homes Directory as a family and a household that does not and will not serve substances to your minor children, that would be fantastic. So please be part of the norm here in Longmeadow and sign up to be a safe home. We have a couple of big events coming up. Narcan training September 21st at the shops. We're going to be adjacent to the farmers market. If you want to come and learn about Narcan and overdose prevention, come on over. Longmeadow Police Department and Close Community are hosting a little table and tent. And then we have the big prescription drug take back. We had 88 pounds of prescription drugs last spring. We're going to do this October 28th on Saturday from 10 a.m. to 1 p.m. at the Longmeadow Police Department. Come drop off your unwanted, unused, expired medications. Oh, this was an update. I don't know if I really checked in with Shelley about this, but someone pitched this idea last year at some point, which was really thoughtful, which wasn't there some sort of distractology driving simulator that assessed students' impaired driving when they're distracted by their mobile phone, like they're like holding their mobile phone, and there is, but then they stopped running it. It was Arbella Insurance. They ran this distractology driving simulator trailer years ago for high school students to practice driving while they were using their mobile phones, and it was a simulation, and it collected data on how safe that was, and it wasn't very safe to do. Someone said, well, can't they just do that with like alcohol impairment and cannabis impairment with those goggles? And so I got the idea to reach out to Arbella. They don't have the trailer anymore, but they donated it to UMass, and UMass's assistant professor of mechanical and industrial engineering, Anuj Pradhan, he is the manager of this trailer, and they really just use it for research at UMass. But what he's willing to do a research project on is allowing Longmeadow High School students to practice using these impaired alcohol and cannabis goggles. If we can get like 100 students to do this, it would be incredible, over the course of a Saturday or something. So they'll bring the trailer down, and then they'll just like collect tons of data on student driving with and without the goggles. And he was really excited about that. UMass offers grants for projects like this, and so I'm attending a call on Friday to talk about how to apply for that sort of opportunity to use a UMass resource like the distractology trailer, and it just seems like a slam dunk. So I'll keep you guys posted. But it's just like we'd be the first coalition of young people in America doing anything like this. I think it'd be really cool.
If I could comment on the last time when they came and did this here, we allowed students to sign up during their ice blocks to go out into the lab. So I'm just saying maybe it wouldn't have to be a Saturday if
if they can come out during a weekday.
Yeah, if it's during their ice blocks, and it was packed. Like
You can
it
get,
was-
tons.
every single
You're right.
spot was
Students
signed
are already
up
here.
for.
Great.
We had to turn students away. So we ran that thing continually.
So no incentive needed. It was
Right.
interesting enough
Yep,
that
it was interesting
Yeah.
enough that people wanted to do it. So
Well, the incentive is they get out of class.
they were
Well, in that class, it was ice block, so it was they were giving up their study time to actually do it. It's like it wasn't out of class time, and I think they had to be a certain age. They had to have
Driving
either a
age.
permit or a driver license
Yeah.
in order to do it. But it was just the novelty of having the thing parked in front of the school and
Yeah.
everybody being like, "What is that?" And this was before you were here, right? You don't remember?
Yeah.
Yeah, you don't remember that. So anyway, you might be able to not have it be. I think it would be a harder sell to get students to come do it on a Saturday.
Yeah, I don't know why I was thinking Saturday.
So,
I'm thinking.
but if you
Yeah.
could get it during the day, that might be.
I think Anuj would love that idea of doing it during a work day and not a Saturday. He was getting I had a talk with him a few weeks ago, and he was just getting more and more excited about the prospect of we could collect the data on unimpaired or impaired youth driving. It was so many things that he would be interested in collecting. And then all the students would actually be practicing skills too of it's much harder to drive cannabis impaired, or differing, more severe grades of alcohol impairment too, based on those goggles. What's the name of the company that makes those?
Fatal Vision.
Fatal Vision. Thank you. So it was just an really exciting project. And if we were able to pull this off, it would just be, I think we'd be sort of a national leader in doing something like that. Because cannabis impairment for young people is a major issue that is really challenging for communities to grapple with and trying to figure out how to deal with it and how to respond. And this is definitely a very specific way to address that. So that's exciting. We've got some opportunities for involvement, folks at home watching on YouTube and watching on LCTV. We have our outreach and marketing, event planning action team, our youth cannabis use prevention action team, our overdose prevention recovery action team, and our assessment and evaluation action team. If you've liked what you've seen thus far tonight, please let us know and reach out to me at info@closecommunity.org to join our next meeting of one of these action teams. And thanks for participating. Oh, wait, we have one more thing. Not just to thank you for joining us, but we wanted to thank Shelley Warren for being our board president for so long,
Mm.
and for being such an amazing leader for the coalition for the last, it looks like almost 8 years, which is unbelievable. She was supposed to have a 2-year term, which did not go well. It's now almost 8 years, so.
And it's gonna be hard. It's gonna
Yeah.
be hard to like let go of some things. But I've said to Paul many times, I will still be here doing
Not
my
going
job.
anywhere.
My job is like the mirror image of the coalition in the school district. So I will still be here doing work that partners with Close, just not in the capacity of being on the board. So, so you won't be rid of me, but just
We know where you
just a
are.
different, yeah, you know where, yes, and I know where you are too. So we'll still be working together, and it has been a pleasure to see this go through so many iterations. Is that the right way of saying it? And since it started, and it was literally just like from when it went from being an idea to actually getting off the ground, to being funded, to having full-time staff, to having like multiple, I don't want to say generations because it's too short a time for generations, but multiple waves of parents and students having come through by this point in time, and it keeps going. So, thank you for the opportunity.
Thank you. Shelley
Do I-
Warren.
Do I open this now?
And Amy Higgins, who is graduating out. Oh.
Thank you, but I'm raising my hand because I would like to say something.
Oh,
Is
okay, I
that
thought you
okay?
wanted attention.
I don't want attention.
I'm
I
just
don't want
kidding.
attention from me.
I'm just kidding.
I want to say a sincere thank you to Shelley Warren because, well, for a lot of reasons, but I have personal experience. Most of you know personal experience with substance use. And so I have some information about how to live a healthy life around and without substances. But I have to say that sincerely, this work and the Close Coalition and all of the work that you've done at the high school changed how I parented my children. And I don't want to cry on camera, but I don't know
Me
if I
neither.
hadn't been sitting in the room the first time that I was in the auditorium at one of the events that you organized. I don't know if I hadn't been sitting in that room hearing the information that I heard, if my parenting would have taken the course that it had. And the work that you have done through this coalition has helped so many people, including me. And I love you, and you're amazing, and I want you to know that you made a difference in at least one family. And I know many more, but
Thank you.
Yeah.
Thank you. I appreciate that.
yep. Thank you.
Thank you.
And thank you to Amy Higgins, who's also
Oh.
graduating off of the board.
Now I'll raise my hand because
Yeah.
I want attention. No, I don't want attention.
Well, Amy has been with us for a couple of years. Yeah, as a
Yes.
board member, and we're so grateful for your work as well. Thank you so much for participating and supporting and being creative and energetic and coming to DC with us. And you've been amazing. And your children have now graduated out of school.
Yep.
So you no longer have any children in the school district. And so you're retiring from being a part of our board.
Mm-hmm.
And we appreciate Amy Higgins. Everyone else supposed to say anything to
But
her.
not
Amy's been
retiring.
involved before being a board member too. Like,
Oh, yeah.
Amy was always a big supporter.
Always supportive.
And
Big
I'm not
supporter of the work.
retiring as being your friends. Yes.
And Amy, can I say something nice about you? You were really instrumental in me becoming sober. I don't want to get emotional now, but I've been sober for a year, and I just we had really good conversations a while ago about that. Chris too. Chris, we had some great conversations. And yeah, really instrumental in me just sort of making a shift. And it's funny, I don't consider myself in recovery, which is interesting, which we talked about last week, but I'm certainly sober. And so I just want to thank you for being so influential and having me make healthy choices around my own life. And it makes this work a lot easier when I'm like, yeah, I don't need to do these things either to feel good.
Yeah. I think that's part of the meaningful work that we do is that we share openly and people learn from it. And I'm glad that in some way me sharing had an impact.
Big time. Yeah.
Yeah.
Thanks, Amy Higgins. Oh gosh, anything else? Any other warm fuzzies?
We have a surprise visit by Oscar.
Oh gosh.
Oh my goodness.
Ladies and
I
gentlemen,
forgot.
Oscar from Washington, D.C.
This is your life.
Yeah.
That would be great.
amazing. Oh, man. We had some fun
If
in
only,
Washington, D.C.
if only.
Yeah. Well, I think that's it. We're going to have a meeting in about 3 months. Stay tuned for our announcement of our next coalition meeting. We hope it's not torrential downpour then. I mean, will it be snowing by then? Jesus.
Yeah, could be.
Sorry. Could be. But we want to thank LCTV again and Brian and Doug for sticking it out and supporting this production of this coalition meeting. Thank you so much for joining the Close Community Coalition. We hope to see you again and come out and support our event. Hopefully we pull together a screenager screening.